Hello, everyone, and welcome. Come on in. Welcome to Conversations with Caregivers and Families. I am your host today. My name is Dr. Quinn Galloway Salazar. I'm an Army veteran. I'm a spouse to a retired combat veteran. I'm a caregiver, and I'm currently serving as the creative advisor for Psych Armor. Here's what I know for sure. Behind every great initiative is a vital ingredient, and that vital ingredient is each and every one of you who are joining us today. The people who we connect with, the people that we connect with in this space, in this work, in this hard work. We're thrilled to be able to provide essential programs such as conversations with caregivers and families, which are made possible through the generous support of the USAA Foundation. At the heart of our collective mission is a deep desire to understand and to connect with the amazing individuals whose lives we touch through our work. And this is where you all come in. We're inviting you at this moment to take part in a quick and completely anonymous demographic survey, which will be a game changer in keeping this remarkable program alive and thriving. It's our hope that you will participate. You should see a poll that has just shown up on your screen. If you would so kindly, please fill it out for us. Thank you. We'll give you another moment or two to complete it. For those of you all who have participated, a huge thank you for doing so. Together, we can ensure that the impact keeps growing, benefiting countless lives along the way. I am so excited for today's conversation. Matter of fact, I'm ecstatic about today's conversation. If this is your first time joining us, welcome. If you are a returner, welcome back. Please take a moment, if you will, and jump in the chat. Let us know where you are. We know that it is also Olympic season. If there is a sport that you are watching, well, hopefully you're not watching it right now, you're recording it right now. If there is a sport that you have watched that you love, a sport that you play, something that you want to share, please drop it in the chat. Drop questions, communicate. We want to keep this discussion, this conversation as lively as possible. Every episode provides us with the opportunity to virtually engage and learn with fellow military and veteran caregivers and families about difficult issues that affect our lives. Through our engagements, we can learn together, discover new resources, transform the narrative of our own experiences, and build resilience. Please also note that this virtual event is being recorded and it will be posted on the Psych Armor website, and it will also be posted on our YouTube channel. Today's conversation is the second episode of the year, and we are so excited to have our returning guest, a friend, a family member of Psych Armor, Melissa Comeau. Melissa serves as the director of the Military and Veteran Caregiver Network at Red Cross. I say this with sheer delight that Melissa is a champion of the whole health model and is always willing to have a conversation that matters. It's a pleasure to have Melissa join us today and explore the model and its benefits to caregivers and families. Our hope is that this conversation will both empower and equip everyone with the knowledge and resources necessary to navigate your whole health journey successfully. So Melissa, my friend, welcome.
Thank you, Dr. Galloway Salazar. It is always a pleasure to be with you and my family at Psych Armor, and on a topic so close to my heart, that of whole health.
Absolutely. So Melissa, before we jump in,
Mhm.
For those who have not had the opportunity to meet you, can you share a few things about yourself, your why? What fuels you to this work? What makes you so passionate about the work that you do?
Oh, what a wonderful question. Great way to start the day. Um, so most of you who might know me know that I am a caregiver myself. So I am a proud Marine Corps spouse and caregiver to my combat wounded husband. I have been on the military family journey, and then transitioning to the, veteran caregiver journey for a little over 16 years. It is deeply personal to me. All of my friends and extended family, those in my community, those that have served our country and then served those who served our country are in my inner circle. So it is intensely personal. When I first found out I was a caregiver, because I had to be told, I didn't necessarily know. I was at down at Camp Pendleton at the hospital there, and a very nice nurse came out and said, "Oh, are you Stephen's caregiver?" And I was like, "No, no, 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 no. I'm his wife, you know." And she very politely smiled and said, "You're probably both." And learning that that was the word that I was going to have to take forward, the identity, the piece that was missing from support I was looking for. I really wanted there to be more support for military and veteran caregivers. We were finding each other on MySpace and in quiet little corners of hospitals, but I really wanted to be a part of bringing caregivers together. Some of the greatest support, the greatest friends I've made in this space have walked alongside my caregiving journey. And from time to time, you need that safe place to share the tough stuff and also celebrate those wins. And so it was a very deep honor of mine to be able to help create the Military and Veteran Caregiver Network, which is now at the Red Cross. And we are serving nearly 12,000 caregivers with best in practice, evidence-based peer support. So we do that a couple ways with our mentors and our online community, which operates 24/7, safe, secure, separate, all about the caregiving journey. And then most popular are caregiver peer support groups, which are virtual, so caregivers can join from wherever they are. We also do text only, because sometimes you can't leave your care recipient or hospital setting, or it's just not appropriate to talk out loud about what you're dealing with. So we do have a variety of options to support caregivers. And I would just say we're building what we wish was there in the early days. And it continues to be dynamic and grow and shift. And we learn from each other and we grow from each other. And it's really just been the honor of my life to serve my fellow caregivers and fellow family members.
Yeah, yeah. That's spot on to identifying your why, and I think many of us can, um, we hear when you said, we can feel also, you were told you were a caregiver.
Mm-hmm.
I think for so many of us, we have this feeling of this is just what we have to do, right? Like as a spouse, as a mom, as a family member to care for someone, this is just what we have to do. But to be able to identify and say, I am a caregiver, that's huge. So thank you so much for leading with that. Thank you so much for the amazing work that you are doing in the field. Uh, Across the lifespan, right? Across the lifespan for our service members, veterans, caregivers, families, survivors, like the entire ecosystem of care. We greatly appreciate it. So, with that being said, I am so ready to jump into this conversation. This conversation about whole health really has shaped, right? It has shaped from having a podcast episode with Behind the Mission on talking about whole health for veterans. But then we said, what about whole health for caregivers and families? We know that, as we dive into whole health, we know that the model has been based on placing the veteran in the center. But
Mm-hmm.
what does it look like if we place intentionally the veteran, the caregiver, the family in the center so that we are ensuring that what matters most to each and every one of them is cared for intentionally. So with that, I am going to turn it over to you, Melissa, with this
Okay.
very first question. What does whole health mean, right? What is this said whole health model in the context of military caregivers and their families?
Absolutely. So I have to give a lot of credit where credit is due here, because like you, Dr. Galloway Salazar, when I went to the VA and learned about the VA whole health model for veterans, I immediately raised my hand and said, what about caregivers? What about families? Because this is such a beautiful and impactful way of approaching health, anyone's health. So my brother in whole health is Mr. Ron Rutherford. He manages partnerships for the whole health. And he and I really work together on what that could look like for other military connected communities. So when we talk about whole health, and I love this, I call it my whole health flower. And you'll see it says me in the middle. And that me is you. It's who's ever watching this. It's who's ever considering their own health. You are in the center. So when you look at this and you see that me is you. Whole health is a completely different approach to healthcare. If you are in the military or veteran space, that you get your diagnoses, you get your medications, you get your treatment plans, and it's very focused on what is maybe wrong with you. What situations do you have going on that are not optimal? It really is disease focused, and much of American healthcare is. We look at, you have this condition, and what can we do to solve this condition? Um, when you look at the whole health model, you'll see we aren't taking away any of that clinical care, because that's obviously very important, but we're adding different facets of your care that you might not consider that contribute to your whole health. So it really emphasizes that holistic, proactive, you-focused model. And we'll just kind of go, I don't want to give this as a presentation, so I'm going to flip through these slides pretty quick. If you go to the next slide, please. This is about money. So sometimes people think, oh, if we just had more money, if we just paid more for our healthcare, if we just had more funds, we could get better health. And that's obviously not true. You'll see the red line here of the United States, and this is the money we spend on healthcare. And you can see for the United States, we spend a lot of money on healthcare, and it's not translating to longer life expectancies. So I just put that in there to, if you think you could buy your way to health, that isn't always the answer. Next slide. Now, this is one of my favorite slides, and you probably all have heard about the social determinants of health. That your social and economic factors are the biggest component of your health: where you're born, what your community looks like, who you are, who your family are, your social and economic factors. But what people don't look at is 30%, another huge, huge chunk of your health is your own health behaviors. And so while we are trying hard to, build better social and economic factors for health, there's one piece of this that we can also all take accountability for and responsibility for, and that is our own health behaviors. So whole health really gets at that 30%, that part where you in the center, me at the bud of that flower, your behaviors are 30% of your health. And we'll just go to the next slide. So I mentioned we talk about healthcare as diagnoses and treatment plans and what's wrong with you and what are your ratings and all of the ways we talk about healthcare. But paying attention to different things actually inspires people to understand what they want their health for. So asking what's going right. Maybe you exercise every day. You get some sunshine every day. You are, on the latest and greatest of the nutrition cycles. You have a really good faith-based community. Your family unit is solid. There are things that you can look at that are going right. What are you good at? And what really matters to you? So you talked about that. What matters? And so when we talk about whole health, we talk about our mission, our aspiration, and our purpose, our map. And I think that really aligns with the Olympics as well, right? We've been talking about how beautiful it is to see these athletes just have a mission, have a purpose, have an aspiration, and they're hitting it out of the park. So thinking like an Olympian, what is your mission, aspiration, and purpose? And we'll go to the next slide again. I'm not trying to make this a slide deck. But another point of this is peers. Peer support is my other baby. And I just really believe that learning from one another is so powerful. And what we've done at the Military and Veteran Caregiver Network is we have it's a social learning, it's a peer support opportunity to go through whole health. We offer a 6-week course on whole health, and you're going through it with people just like you. You're going through it with people in your community. You are going through it with people of a similar lived experience. And so leaning into not feeling like it's clinical, it's not a doctor telling you what to do, it's not a social worker coming in, it's not an expert. It is another human being walking alongside your whole health journey with wanting the best outcomes for you and you wanting the best outcomes for them. So this is just a little quote that we have in there. And then our whole health flower. And this is what it looks like for caregivers. It's exactly the same because no matter if you're a veteran or a family member or a caregiver, you can be at the center of your own health. And I love this little equation at the bottom. So it's me plus my self-care plus my professional care plus my community equals whole health. So again, just thinking about different aspects beyond the treatment plans and prescriptions and diagnoses and what's in your My Healthy Bed or your healthcare portal. Your health is far more than that. And if we look around the petals, which I'm gonna have you go back, Emily, sorry. This is my favorite slide. If you look at the petals here, you'll see, I'll just go around, moving the body, right? This one doesn't say exercise, it says moving the body, maybe enjoying more energy and flexibility, the power of the mind, healing and relaxing, your spirit and soul, talking about your spiritual health, very, very important. Your family, your friends, and your coworkers. Relationships have a huge impact on health. Recharge, what does your sleep and rest look like? Food and drink, notice it doesn't say, health food and drink. It says, how are you nourishing and fueling your body? And then another one that's really deep is that personal development piece. What are you doing in your personal life, in your work life? And I will say that there's a caveat here, especially for families and caregivers, because there are huge shifts in what that can look like and what that can feel like. And so really honoring that as part of your health can help you with some of the hurdles in identity, in loss, in ambiguous grief. If you still have that personal life or your work life, whatever that might look like. And you'll see in the blue ring, it talks about prevention and treatment, right? So you're still wearing your sunscreen, you're still getting your annual checkups, you're getting your conventional and your complementary approaches, right? So maybe you take massages. Massages can be medical. Maybe you're doing acupuncture. These are complementary. They're not alternative, they're complementary to the conventional care that you're getting from your doctor. And then that outer ring is community. And what does that community look like for you? Is it where you live? Is it your community online? Is it your church community? Is it your school community? All of that really does house your whole health experience. So it's an important thing to think about that I don't think we're talking to our doctors about. So how can we incorporate that into our own healthcare approaches? And then we'll go to the next slide, which this next slide is right out of our MVCN whole health because it's values based. And maybe you have never even taken a moment to think what your core values are. How do you know what is most important to you? How do you attach value to the life that you're living? And so we walk you through some exercises where you can, this is a short list, but there are others where you can really figure out, what your core values are for you personally. There's no grading of this. There's no, right or wrong answer. This is just for your awareness. And when you operate from your core values, that is another core component of whole health. We want you to be true to yourself and what matters to you. We'll go to the next slide. So I've talked about our mission, aspiration, and purpose in life. And again, this is right from our MVCN version, which is the VA's version, and what really matters to you in your life and what brings you a sense of joy and happiness. And we go through exercises where we score, certain areas of our whole health. Maybe we're not where we want to be, or maybe that one isn't as important to us. And it's dynamic. So at some point in time, your food and drink might be really, really important. And then at another time, you're like, man, I really got to focus on my spiritual health. And that's the beauty of it. I mean, you're going to get these skills for life. You're going to have these internal checkpoints where you can go, oh, I might not be operating at my core values, or I'm not paying attention to a certain part of my health that's really important to me. and what can I do, little or big, to, kind of course correct there. And again, I just love the idea of joy and happiness. I'm a huge fan of positive psychology. So, not always focusing on what's wrong, but really leaning into what's right. And maybe you can do more of what's right, and that can be meaningful for you in your life. And speaking of meaningful, so there are so many whole health resources. So, VA has Live Whole Health. And if you haven't been on there, it's a great opportunity. Like, I just need to relax for 15 minutes. You can go to Live Whole Health and you'll find a video that can help you. The MBCN, we do a well-being U for caregivers, and this is where we take one of these activities or another one of our own activities, and we run caregivers, family members through a 15-minute max. Sometimes they're 8 minutes, sometimes they're 10 minutes. Whole health activity. And this is just to really create the time and the place to do a little self-care. It is not to put it on your list. It's a time and a place. It's there. It's a chance to do it with peers. And if you miss it, don't worry. It's in our library. You can go and visit it anytime that's convenient to you. But we're trying to introduce you to all sorts of different whole health self-care practices. So you'll see some on the screen here. Some you may have heard of, some you may not have. I'm a huge fan of the guided imageries, and they have gratitude, kind of meditations and things. But sometimes you just need a chance to do them, and that's what we're doing. We're just giving you that time and space to do it with your peers and maybe learn a new self-care practice that you didn't know before. And that's the end of my slides, because like I said, I didn't really want it to be the clinical explanation of whole health, and I'm hoping we'll get some questions from the audience as well about how whole health can be for them, because the first time I heard about it, it seemed a little abstract. So happy to get into the nitty gritty and happy to talk about it more holistically.
I love that. I love that. And I love how you looked at the diagram, right? And the circles, and you labeled them as petals, right? And areas for us to be able to bloom.
Mm-hmm.
And I share that because historically we have looked at our health from a physical standpoint, an emotional standpoint, a behavioral standpoint. And now we are charged and challenged to intentionally bloom, right?
Mm-hmm.
And look at other areas of our health that make us whole. The very first time I was introduced to this model, I had to print it and put it in my office because there were so many areas that I wasn't focused on. We spend so much time focusing on the health of whoever it is that we're caring for, our children, our parents, fill in the blank, that we often forget about what walking in a park can do for our health, right?
Mm-hmm.
What yoga or what acupuncture or massages or eating more fruits and vegetables can do for our whole health. So let's dig in a little bit about, you mentioned what matters to you, right?
Mm-hmm.
You go to the doctor's office and you're told you have high blood pressure, you have all of these things. But what matters to you, not what's the matter with you, and what do you want your health for?
Oh, that is the dream question, right? What do you want your health for? I can still remember the first time I was asked that question, and I had no idea how to answer it. What do I want my health for? To be healthy, right? To live a long, healthy life. And again, it's very abstract. The
Yeah.
more you dig into whole health and sort of the values and your relationships and your life goals, I'll give you some examples that have shown up and been really meaningful in our work with whole health. Wanting to walk your daughter down the aisle when perhaps you are diabetic and currently dealing with some neuropathy. What can you do to walk your, that's the most important thing. That's what you're going to focus on, is walking your daughter down the aisle. And that will inspire someone to change their diet, to look at medication, to listen to their doctor, to find holistic or alternative solutions. Because when we lean into what matters the most to us personally, we can find inspiration there. Whereas just being labeled diabetic and it's a lifelong chronic thing you're going to have to deal with, there's not a lot of inspiration there. There's not a lot of hope there. Certainly not a lot of joy. So again, that reframing to what matters most to you. What do you want your health for? And it can be as, sometimes it's, ceremony based like that. Another caregiver said they wanted to be able to walk Europe in their retirement. So most of
Mm.
us have quite a sedentary lifestyle, and maybe you have some retirement goals, but every year I put on more weight sitting at this desk. I'm getting less and less active. And as we age, our body changes. So, what can I do now in my own health behaviors to ensure in retirement I can walk the non ADA compliant Europe? And we see caregivers, oh, I'm going to get a pedometer, so I'm getting my steps in. I'm going to, see if there are supplements I can take right now that can help my joints over the next 20 years. But again, learning what you want your health for. Now, I do, because I work with caregivers and I love caregivers so much. I will tell you, a lot of times we hear a very beautiful statement where someone is like, I want to be able to care for my loved one indefinitely. And that is beautiful. That is service. That is beautiful. And I scratch at that and say, what's deeper? Because your health matters just to you. What does it matter just for you? And now a lot of my health is related to being able to care for my husband and my child. But I also know my health matters too, just for me as a person, not so that I can serve as a caregiver or as a mother. So that's an important distinction I see in caregivers. It's so noble, right? We want our health. We want to be there. We want to be able to care for our loved ones as long as possible. We want to be able to lift them. We want to be able to, help with safe transfer. We want to make sure our mind's straight so we can manage those medications. But a little bit deeper, if I could just scratch that and get people to think about their own health and know that it matters. We actually named our whole health for caregivers. Caregivers, your life and your health matters because it's beyond just being a caregiver that you want your health, and we want to help you get there. Even if being a caregiver is super motivating and that's going to help you, I just always like to scratch that a little deeper because I do want people to know that their health matters just because they're a human.
I had to write that down. That's so powerful because as caregivers, we're always placing someone before us.
Mm-hmm.
But I was having a conversation yesterday related to suicide prevention, and I was sharing, once again, as caregivers, we're always giving, 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 and our gas tanks are depleting, depleting, depleting. We have to intentionally change our internal messaging to also say to ourselves, we matter too. And if we can't give, we have nothing to give, we have nothing to give, and we have nothing to receive for ourselves as well, right? So making sure that we have a clear understanding that our life and our health matters is huge. It is so huge. Self-care, I've recently have heard a few people say, you know, we're talking about self-care all the time, and it's almost becoming this buzzword. We don't
Mm-hmm.
have time to practice self-care in the busyness of our world, in the busyness of our space, in the busyness of our communities and our homes. How are we supposed to practice self-care if it's just one more thing? But I think when we talk about it, just from the standpoint that you're sharing, we're inspiring a shift. We're inspiring that inner dialogue that we have to change so that we can better our behaviors and overarching better our health outcomes.
Absolutely. And I am with you. If I hear that, put your mask on first before, the way we talk about self-care, and it's this, you have to do it, you should be doing it. If you're not doing it, you probably should be guilty that you're not doing it. It's on that long list of things you have to do. And I see uh, something in the list, self-care is giving your best, not what's left.
There you
And
go.
so I have actually, there was an Eastern philosophy quote that came out of some of my whole health work, and it was like, you should meditate 1 hour a day. And I was like, that is crazy. But the quote goes on to say, unless you're busy, and then you should meditate 2 hours a day. And so I will never be someone who can get there to that 2 hours a day of meditating, but that resonated with me because when you are feeling the busy, when you are feeling all of the weight of the things you need to do, that is actually where you need to reframe and go, oh, I need to do some more for me. So when we talk about that reframing, it's not to add to the list. It's not to be one less, one more thing on a very long list of things you should be doing. It's to reframe you as the center of your flower. And I'm feeling all of this, so I need to make sure I'm taking care of myself. And so that Eastern philosophy, like you should meditate every day for 1 hour, unless you're busy, and then you need to do it for 2 hours. Sometimes I just use that to really understand if I'm feeling that busy, if I'm feeling all the have tos, should have, could have, mothering, caregiving, working, that's actually when I need that self-care the most. And so trying to find ways to honor that and to create that space for myself because I matter too.
Yeah, absolutely. Now, digging a little bit deeper and thinking about, we talked about whole health for the veteran, we talked about whole health for the caregiver. Let's talk about the family, right? Teens and young adults. What advice would you give as it relates to whole health for teens, young adults who may be family members, maybe caregivers, hidden
Mm-hmm.
helpers as well? Can they also utilize the whole health model? And if so, can you give us some strategies or some ideas that we can help to reinforce that message to them?
Absolutely. So there is a gap for children and youth and teens in the whole health model. It's relatively new, and we've heard a lot of it in the adult space, really in some chronic condition spaces. And then I pulled it out. We're bringing it to caregivers and families. But my ultimate dream is to introduce this model to children. I know we get some health education when we're younger. And again, it's usually very positive. I don't know if you all did the jump rope stuff for the American Heart Association, where physical activities encouraged, and we all learned our little pyramid for the food. But I really do think there is a child friendly way to introduce the idea of whole health to children and teens. And I mean, my son's heard of it because he is what we would call a hidden helper. And so understanding the need for self-care, understanding when you're overwhelmed, understanding that your health isn't just when you go to the doctor. We talk about mental health days, we talk about, sometimes you need a treat day. So maybe even if you are on a nutrition journey of sorts, you go, today's a cupcake day, and we honor that, and we know that's not the end of the world. So finding ways to introduce your children to self-care and knowing that their health matters and their health is so much more than that one physical they get at the doctor. I think sports are a great way to introduce kids to different health ideas. Um, but again, giving them the language, the age appropriate version of whole health is definitely something I aspire to help create. Because I do think, we could have a pinwheel that talked about these things in different ways, and we show kids that they're the center, and we give children the opportunity to learn what their values are and how to
Yeah.
operate from their core values. I think it could really impact not just public health, but just mental health and having people focus on what really matters to them in this world of constant distractions and sometimes negativity.
Yeah, absolutely. I love, for those of you all who may be joining us today that are in the space of public health research, and you heard the keyword, there's a gap. That means that we need to do something about that and fill in that gap and start the work in figuring
Mm-hmm.
out how we can build programming and messaging and strategies for our young children, for our teens who will become adults, who will need supports, who will need a community and this ecosystem in their whole health. So thank you for expounding on that. And thank you for charging us all to realize that there is more work that can be done with this model to expand and to bridge across our entire military and veteran community. Another question for you. So the VA, and this may be a VA-centric question that we may have to take back to the lab. And when I say lab, I mean back to our colleagues and friends at the VA. But a question that has come in is, an audience member would like to know if the caregiver has the same opportunity to use the same things, right? Or the same treatments in whole health as the veteran that they care for. So, for example, acupuncture.
Hmm. So no, unfortunately not. I don't know that in all cases. I know that the when we talk about whole health in the self-care realm or the complementary medicine realm, that is still very much for the VA focused on the veteran. Now, the caregiver support program also does have whole health coaching. I don't know if they have access to acupuncture. I shouldn't have just said no. Top of my mind, I go, no, I don't think that's an opportunity. Um, so, you're going to be paying out of pocket or going through your TRICARE, whatever it is to get that, complementary therapy approved. But there is the taking charge of my life and my health. Taking charge of my life and my health is the VA whole health kind of peer support led program that is for veterans. So they are offering this in VA hospitals. And I have heard, now it does vary VA to VA, but sometimes they'll allow the caregiver to come as well. So you can go with your veteran through that. And sometimes that's very healthy, right? Go with your partner, go and learn. Maybe it's your father you're caring for, and as the caregiver, you can be a little bit helpful, but also you can focus on yourself for a little bit. I think there's a win-win there. And sometimes caregivers are like, oh, I can never really talk about my whole health with my care receiver, so I would want something separate for me. And that's why we have the Military Veteran Caregiver Network version, which is Caregivers, Your Life and Your Health Matters, which is only for caregivers, right? So there's no veteran. Some caregivers are also veterans, so there are veterans in there. I don't want to misspeak there. But the focus and the language is more caregiver centric. When you go to the taking charge of my life and my health at the VA, it's more veteran centric. Now, you can get what you need from those. And again, it is varied on which VAs have capacity to include caregivers, but I do know Caregiver Support Program has whole health coaching, and they might have resources for things like acupuncture or massage or Tai Chi or, what other kinds of alternative or complementary approaches you're interested in learning about.
Yeah. I'm hearing you say is that the worst that you can hear is a no, not yet, not
Mm-hmm.
now, but to ask, right? Wherever you were located, whatever VA that's right there, whatever VISN that's right there where you live, ask, right? Connect
Mm-hmm.
to that caregiver support program, learn about that coaching, learn what may be external to that VA medical center, right? There may be partnerships that are in the community that you do not know exists. So for sure, definitely connect with your VA centers, your VA caregiver program, your whole health program, and see if there are ways that caregivers can be a part. And if it's not there yet, advocate, right?
Mm-hmm.
One of the biggest things we can do is advocate. That's how change happens. It's when we're able to be willing to advocate for what we need. Thank you, friends. So going back to the petals again, because
Mm-hmm.
I think that there are more than just you and I, Melissa, that are in love with the idea of the petals. Is there a book? Is there a resource that I know, of course, we can go to the VA's website and extract the model from there, but from Red Cross, is there a book? Is there something that's tangible that folks can go and download a PDF or get the book online that can really they can dig in further to what each one of those petals mean and how they can strategize how to best utilize each of those petals.
So not only do we have a workbook, that will walk you through step by step, we offer a 6-week workshop that aligns with the workbook with those downloadable PDFs, with the values exercises, where we're going to go through every single petal and give you more information. We're going to give you the chance to self-reflect. Where am I with food and drink? Where am I with personal development? Where do I want to be with those subjects, and what kind of steps can I do to get there? We're going to give you SMART goal walkthroughs. We're going to help you tighten up. We're going to offer you accountability partners. So as you're working through whatever whole health petal you want to work on, you have a team of people in your group that are also going to encourage you and check in on you. Surroundings has been a popular one, like your home environment. We've seen people do huge clean outs of closets, right? And that was like something holding a lot of their mental energy, and cleaning that out and donating things, and then having a space for the grandkids stuff has been really powerful. So the book, I mean, you could theoretically just go through it yourself. I think there's a lot of value in going through the course with your peers, and a whole health facilitator. All of the team at MBCN, we have been trained by VA Whole Health, so we are trained facilitators. So we can give you lean in for some extra support, some extra resources. Oh, and speaking of resources, because when we were talking about acupuncture, we do tend to think, our VA has great resources, and they do. That isn't to say that they don't. But oftentimes there are community resources. There are things outside of our entire military space that are out there to help you just as a person. And we have a resource directory at Red Cross that, again, it's a social care resource directory. So it covers far more than just military needs or caregiving needs, medical needs, things like that. It's really a social care resource directory. And I was already inspired. I'm like, I'm going to go look up acupuncture after this to see if there are resources in my community that, again, are outside of that traditional military space, because I do think acupuncture especially might have its own resources that I just don't know about, because I've never looked at them just as, Melissa looking for acupuncture in her community. So I'm taking that as a to-do for myself. But want to inspire people as well. So you can advocate for the resources that are not there, but then sometimes looking in other places, you'll find that they were there. And
Yeah.
if not, another opportunity to advocate.
Another opportunity to advocate. I love how you are tying in the community, right?
Mm-hmm.
Because community is so important. What I'm also seeing in this whole health space too, is that you have veterans that are in these spaces that are realizing that some of the complementary approaches they can deliver in their community. For
Mm-hmm.
example, you're seeing a lot of farming that's happening, right? And we know that getting in that dirt, and I'm saying that like I get into the dirt, I don't have green thumbs, right? I don't. However, for those that I'm hearing, there's so much benefit to the gardening and the farming as it relates to whole health, right? You're gardening, you're watching things thrive, you're able to eat and get nourished from the things that are sprouting
Mm-hmm.
from said gardening and farming. And you have veterans and you have military family members that are realizing that they can offer these services and resources in their community. So definitely, I could not agree with you more. Tap into that social care resource
Mm-hmm.
directory. Tap into your Facebooks and your LinkedIn and ask, right? Just ask that broad question. What's happening I live in Georgia, for example, in Atlanta, Georgia, in regards to one of the areas of one of the petals, right?
Mm-hmm.
Learn more about what's happening in your community. Um, and I'm sitting and I'm looking at the time. I'm like, where did 45 minutes go? It went really, really fast. But I want to take a moment and I want you to share with us. I'm a big storyteller, big story collector. Can you share one success story of a caregiver or a family member who did not really see the benefit of the whole health model at first, but then saw its benefits? And how did that resonate with them in terms of caring for themselves, but also caring for their families as well?
Okay, so I'm not going to use any names and I'm going to be very general because what happens in our whole health stays in our whole health. We really treasure that sort of privacy. But one of the people in our group uh, wanted to quit smoking. And
Mhm.
you know all the health benefits for wanting to quit smoking. And they wanted to quit smoking for their own health. They had some issues that were related to smoking, and I don't have to tell anyone that smoking's not really the best for you. Um, but the reason they wanted to quit smoking was for their grandchildren. They didn't want to be well, it's okay for this person to smoke. They didn't want to be that example. And it took digging into their values, what they value, talking about their legacy, talking about some self-worth, um, understanding negative coping mechanisms. And, then maybe being told alternative ways to quit smoking. Does that make sense? I mean, you can go to your doctor and they'll give you the gum or you take the patch or things. But this person was open to, I'm at a point where it's really important to me. I really need to kick this very long habit that's very unhealthy. And now I see that my grandchildren are picking up on it. And they were open to hypnotherapy.
Wow.
And so that wasn't something that they maybe would have been so open to. I hear whole health, woo woo, all the self care, the tight. Sometimes that turns people off. Um,
Mhm.
and this person was willing to dig a little bit into their values, dig a little bit into their own self worth, and learn about alternatives that they were then receptive to trying. And that person quit smoking.
Wow. That's awesome.
And so that's just one example of the power of whole health. But we've seen people lose weight. We've seen people who have been very sedentary, run 5Ks all of a sudden. Um, you know, Getting their environment in a way that they want, going back to school, dipping their toe in employment when they thought that was impossible now. It's really so personal what whole health is and what it can be, that just being open to the opportunity and to the ideas, I just truly believe this can make a difference for anyone.
Beautiful. Beautiful. Um, so we also know that our animals are our family members as well. And so we received this question. Does anyone think that a military family support dog can be helpful to caregivers' whole health? Or would this have the opposite intent of adding to caregiving duties?
Well, I will speak for myself because we are a family that my husband had a service dog. And for all the caregiving that was engaged with that, the grooming, the vets, the feeding, and all the things that go into taking care of a dog, that was minuscule related to the benefit we got from having that dog. And while the dog was my husband's service dog and then retired and became our family pet, I would never trade that opportunity. Um, but I'm a huge animal lover. And so for me and for my son, animals have always absolutely been a benefit. Um, and I'm getting misty eyed because we lost the dog. And even so, it was so worth the 10 years we had with that dog. The benefit to our entire family could never be replaced.
There's something that pets and animals do to humans, right? And not getting into the science of it, into the science of the brain. But for example, a week or 2 weeks ago, I was stuck in Portland when the IT outage, the global
Oh
outage
no.
happened. And I had a friend to pick me up and we hung out and I hung out with her dog. And I was frantic and I was stressed because I was heading on a family vacation that I was risking the fact that I might miss because of the outage. But what that dog did, because sometimes our pets can sense things in us that other humans may not be able to sense. And that nudge or that biscuit making that cats sometimes do
Mhm.
is almost a therapy, right? Right? That purr or that lick, it's medicine as well. And definitely I understand about that care. It may become an additional duty. But Melissa, hearing your story and hearing what your pets and the impact that they made on not just your husband's life, but you and your kids is huge. It's huge.
Absolutely. I do think if you're able, it's not always appropriate for every case. But I would say that echoes, and when we think of our whole health, learning what really matters to you and learning what your real joy is, right? Like just reframing what you even think of. I'm reminded of another just interesting way of looking at your life that came out in Full Health. And there's only two people you need to make proud. And the first is your 8-year-old self. Would your 8-year-old self be happy with how you're living your life right now? And the other person is your 80-year-old self. Would
Oh,
your 80-year-old self be happy with how you're living right now? And so me personally, I always wanted two dogs at the same time, or a cat and a dog. But we didn't have that growing up. But as an adult, I've been able to honor that little 8-year-old girl's dream because animals have always mattered to me. They've always been very, very important. And so I love that for myself. That is how I'm honoring my 8-year-old self. Would be so happy that I have these pets in my life, no matter how crazy my life gets, how many times we move, the vet appointments, all of that. That little girl's happy that I have my two pets at the same time. And then my 80-year-old self is really proud I wrote a book, right? That's something I've written my whole life. I shared one of the most vulnerable times of my life in the hopes of helping other people not feel so alone in those dark times. And that's how I make my 80-year-old self proud. And so, that's just one example, but you can look at your life from different perspectives of yourself and lean into what's important to you and what matters to you. And when you do that, you are practicing whole health. And it's you and you.
now you made me misty-eyed. 8 and 80.
Mhm.
Those two. I have never heard that. However, comma, that's powerful. Thank you for sharing that nugget of wisdom. Am I making my 8-year-old self proud? And will I make my 80-year-old self proud?
Mhm.
I hope everyone that is with us right now jotted that down and posted somewhere on your bathroom mirror, in your car. That just might be your very first step into saying, I'm going to adopt this whole health model. My 8-year-old self and my 80-year-old self. What matters to me, we're not focused on what's the matter with me.
Mhm.
So, Melissa, the future of whole health. How do you see the concept? How do you see the strategies evolving over the next 5 years?
Well, there is the Whole Health Institute, which is out of Bentonville, Arkansas. And they are building a medical school to really push this kind of public health model forward with the goal of helping people live the healthiest life they can based on what matters most to them. I am now getting calls from all sorts of people that maybe weren't engaged with whole health before, but want to learn more. So our chief medical officer at Red Cross, and Red Cross, we collect 40% of the nation's blood. We do the training services. We're really interested in how we can be a positive influence in people's health as well. She went through and learned whole health. So that was very positive from my own space. I'm seeing other corporations talk about it. I'm seeing it it isn't the buzzword that it was so long ago. I think it's more in the language of healthcare. So if you go to your doctor and you say, I'm working on my whole health, your doctor likely knows what you're talking about. Whereas a couple years ago, it was, oh, maybe that woo-woo thing, or oh, you're doing acupuncture.
Yeah. Or you're
um,
doing yoga. Yeah.
yes.
Yeah.
So I'm seeing it talked about more in healthcare, in the public space, in research and the Whole Health Institute, really educating and bringing it to the masses. I also feel whole health is very intuitive. And if you get engaged with it, you start understanding how it can make an impact in your own life and the life of the people you care for, it just builds upon itself. It becomes this snowball effect. The very first time I heard about it, like I said, it was a little abstract, and I just knew I needed to learn more, and I took efforts to learn more. I was texting my team, I'm forwarding my boss folders that I pulled from the resource tables, and eventually we all digested it and said, yeah, we have to take this forward. And it's really important we share this. I'll see it. I think it'll come out in different spaces, and I am hopeful we'll see it in that children and youth space very, very soon, because how beautiful would it be to teach this early and often, to get good, healthy habits instead of some of maybe the negative ones we pick up in adulthood. I just think there's a ton of optimism and positivity around it, and I'm all for it.
I couldn't agree more. I will add, there are 36 of us in this space, in this very moment, that can now begin raising awareness. And if we have children at home, if we have grandchildren, if we have nieces and nephews, if we have family friends with children, we can start sharing what health or components of whole health and what that means. It starts right here with each and every one of us. Going back to our 8-year-old self, what would have been the things that we could have done at 8, right? So think about those things. Maybe jump rope a little bit more. What are some of hopscotch last week, by the way? What are those things that we could have done, and how can we implement that strategically for our future generations? So we can all simmer and think about that. And if you all have some ideas, please don't hesitate to let us know. I think Melissa and I, Psych Armor, Red Cross, our partners, we're all in this together. We are all doing this work to save lives, to impact lives together. Melissa, I thank you so much for your willingness to join us today, to not only share your expertise, but to come to this space being transparent, vulnerable, sharing space, sharing your own lived experiences with us today. Thank you.
Oh, it is my honor. And I do just want to say to everyone on this call, we're in this together. And so I really love that we can build this community, we can build this dialogue, this conversation, and this expectation that our health should be our whole.
Yes, yes, yes.
So I'm here for it. I'm so grateful for you and all the team at Psych Armor who brought this conversation to fruition, and everyone for your time today. Thank you for being with us.
Thank you all. Don't run away yet. Hold on, hold on. You are going to see a QR code that's going to pop up on your screen momentarily. We would greatly appreciate a few more moments of your time so you can provide us with feedback, right? Your feedback is important to us. It allows us to know what we're doing right, what we can improve. And it just helps us to say, this is the right track we're on. We need to do more or less of this. So we're going to throw a link in the chat also for those who don't have your phone handy. So if we could pop that QR code up on the screen, that would be perfect for the caregivers and family members that are joining us today. As Melissa just said, You are not alone on this journey. I see you. We see you. I'm going to say it again. I see you and we see you. Many of us share these experiences, and there are resources that are out there that can support us if we are willing to say, we need the support, we want the support. Please don't let your vulnerability, don't let your pride get in the way. There are folks like us in this space that understand what it's like to be a caregiver, that understand what it's like to be a family member. We walk in similar shoes. Let us know how we can be of support to you. Keep an eye on your inbox. We are going to follow up with resources. There was an abundance of resources that were flowing in the chat, an abundance of resources that Melissa also noted. We are also going to share a few tips that were discussed today. If you have any questions, anything that you want to share, please feel free to connect with the Psych Armor team at support@psycharmor.org. That is it for today. We look forward to seeing you all in the fall for our next conversation with caregivers and families. Have a wonderful, wonderful afternoon. If you're going back to the Olympics, I hope your team wins. Thank you all for this time. We look forward to seeing you soon.